Hello, I'm Dorina Landa, and I'm the Executive Director of Advancement at the University of Toronto's Temerty Faculty of Medicine. I'd like to begin today's event by acknowledging the land on which the University of Toronto operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. And it is my pleasure to welcome you today to The Age of Anxiety, the latest installment in our Temerty Medicine Talk series, and our final for the academic year before we break for the summer. We're delighted to have these virtual opportunities, to showcase some of the important work underway at Temerty Medicine and across our partner hospitals. I hope you enjoy today's discussion and very much look forward to hosting more events in the fall. I'd now like to turn things over to Trevor Young, Dean of the Temerty Faculty of Medicine.
Hello, I'm Trevor Young, Dean of the University of Toronto's Temerty Faculty of Medicine. In September, we announced a landmark $250 million gift from James and Louise Temerty and the Temerty Foundation. As the largest philanthropic gift in Canadian history, it still takes my breath away. Their donation is an investment in our shared vision of the future, one where we'll champion enhanced discovery and collaboration while also striving for excellence through equity in everything that we do. Throughout this series, we're going to tell you about some of our remarkable research and programs that will advance health and healthcare both here in Canada and around the world. To help guide this conversation, we've got André Picard, our good friend and the award-winning health columnist for the Globe and Mail. André, thank you for making time for us and for all the great work that you do.
Well, thank you, Dean Young, for that kind introduction. As you heard, I'm André Picard, and I'll be moderating today's Temerty Medicine Talk on the Age of Anxiety. There's no question these are very anxious times. At the best of times, everybody worries. We worry about our families, our jobs, our health, and much, much more. 18 months of pandemic living have left people feeling like their anxiety levels are sometimes spinning out of control. But is worrying always harmful? And if we can eliminate anxiety altogether, should we do so? Or how can we better manage to live with it in our daily lives? These are some of the questions we want to explore with our all-star panel today. So let me get right to them and introduce them. I'll start with Dr. Kymm Feldman. She's a family physician at Women's College Hospital. Hi. Dr. Trisha Tulloch is an adolescent mental health specialist at CAMH. Will give us a wave, Trish. Hi. And Dr. Sanjeev Sockalingam is Vice Chair of the Department of Psychiatry at the University of Toronto. And finally, Dr. Jodi Lofchy is an emergency psychiatrist at Unity Health. And as you can tell, I gave them very, very brief introductions, but you can read more detailed biographies in the chat window if you click below. Now, thank you all for being here. We don't have a lot of time, so I really want to wade right into it because it's a great topic. And I'm going to start, if I could, Jodi, with you with a really fundamental question. Tell us, what is anxiety and how is it different from worry? Give us a sense of what we're talking about today.
I think we're talking about a basic human emotion and signal system that we have that's very helpful to us in terms of protecting us from danger. So, what is anxiety versus what is worry? I think worry is a thought process that we have intermittently when we are under stress and when there may be actual things to think about and perhaps worry about. We move along a continuum to anxiety, and I don't want to pathologize typical anxieties that are short-lived. But when anxiety becomes sustained and starts interfering with our ability to lead our lives, and interfere with our functioning, whether it's to be able to interact or do our jobs or focus, and there can be actual physical symptoms with a state of anxiety. So I see anxiety as a whole sort of total body experience, whereas worry is more cognitive and it's a thought process, and hopefully more less sustained and more discrete. So
Great.
that's a
That's
short
good. That sets the stage. That's a good beginning. And Kymm, I want to ask you, as a family doc, when should they get help? When do they know they've crossed that line from just normal worry to anxiety that's bad for their health?
Yeah, so that's a great question. I'd say that, with any medical issue, it's at the point where they start to get concerned about it when it actually is affecting their day-to-day life. So when it's affecting their life, when it's affecting their relationships, their activities of daily living, that's when things, are at a significant enough level that they may need to reach out. Now, having said that, people often reach out long before that. The context of family medicine is such that we know people in the longer term. We may have had situations with them where they've been through distress in the past. We may know their families, their parents, maybe their siblings, their children, etc., maybe our patients. So that relationship often will bring people forward further, or earlier rather, just to sometimes say, you know what, I just want to touch base. I think I'm okay. Do you have any thoughts or resources? Sort of that yellow flag, and of course, all the way on the continuum to where people are really struggling.
Great. And a couple of things in there that we'll explore a bit later. You suggested it's contextual. It depends. And don't wait too late to get help. So we'll talk about those more in a moment. Sanjeev, if I could turn to you, I guess the question is anxiety always a bad thing? I sort of have this idea in my mind that we're wired in a certain way. Cortisol, adrenaline are things that prevented us from getting attacked by saber-toothed tigers or something like that. Is it always bad to be anxious?
Well, André, it's a great question. I think, as you've highlighted, anxiety is, and as Jodi's alluded to, anxiety is one of the key emotions that is one of our signals, right? Our fight or flight and how we respond to danger, threats in our area. And so whether it's in our day-to-day environments, whether it's in work situations, anxiety is a cue for us to really take stock, think about ways we might protect ourselves, adapt or change in those settings. And so we need anxiety in order to kind of look at threat, but also for getting prepared, right? So we get anxious before exams. It helps drive a bit of our anxiety to start studying a bit more or asking more questions. So those are adaptive and expected and useful for us. And as my co-panelists have alluded to, it's when it gets out of control and we have less predictability that it becomes problematic. And that's when we can start to seek help and use some of our skills to try to manage that.
And now, Trisha, I think this pandemic has been particularly hard on young people. They've been cooped up. They don't have their normal social life development. I'm wondering if you, as someone who deals with adolescents mostly, are you seeing a surge of anxiety in this group that's, I think fair to say, often anxious at the best of times? Are you seeing a difference?
So yes, and thank you, André, for the introduction. I just thought for some clarity, so as a pediatrician and a subspecialist in adolescent medicine, I have been providing consultation to the Center for Addiction and Mental Health in terms of the adolescents that are seen in the inpatient setting and also in the ambulatory setting. And then also in the community and also in the tertiary care setting at the hospital, at Sick Kids Hospital. And we certainly are seeing a surge in terms of the presentation, mental health deterioration in general. I think if you think about the data that we are aware of nationally, provincially, and then the work that's being done at Sick Kids, we've seen a trend and we've seen upwards of 70% of school-age kids as well as adolescents who are presenting with at least one mental health domain that is, in a sense, on the decline, or at least there's some endorsement of deterioration. And this was noted in the first wave of the pandemic. So in addition to this, though, we've seen an increase in terms of substance-related concerns. So presentations to hospital from adolescents where they've been either have had toxicity or they've been engaged in risky behavior and may have had injuries. We've also seen an unprecedented surge of adolescents presenting with eating disorders requiring hospitalizations. And so although it may seem as though these are a multitude of different clinical presentations, there are at times for example, with substance use, it may be that the adolescent is in fact using substances as a way to self-medicate. So it's a little bit trickier, I think, when we think about our child and youth in terms of how they present. I think they present in a number of different ways and in a number of different settings as well. So this certainly lends itself to being a little bit more of a complex situation. And certainly as an adolescent medicine physician and pediatrician, these trends and this bigger picture is quite troubling.
And Kymm, I think you have some data as well for family physicians are collecting data on this. Are you seeing this trend that there is more anxiety? I said at the outset, everybody's anxious, but there's actual data, right?
Yeah, absolutely. So the U of T Practice-Based Research Network, it's called Utopian, led by Michelle Griever and Karen Tu and others in our department, allows us access to statistics for about 370,000 patients and patient visits. And it's interesting, what they've seen was obviously at the beginning of the pandemic, there was quite a drop in visits altogether for the first 3 months, sort of March to June, particularly in men and particularly in those under age 18. And then, the increase was quite significant. Anxiety has always been or at least in recent years, been the most common reason that people seek help from a family physician. And that just shot up significantly, and particularly for women in all the age groups, and concerningly, particularly for that 10 to 24 age group that Trisha's talking about as well. And for men, interestingly, it stayed rather stable, except in the oldest age group for men, it did tick up a little bit. So at the same time, we were talking about the fact that in that same time period, or at least until the data was presented for October 2020, there wasn't an increase in antidepressant prescriptions. So again, that may just be a lag, and we may see an increase of that. I would be surprised if not, but that remains to be seen.
And maybe, Sanjeev, we've heard the mention here of antidepressants. Can you talk about practically, how do we treat anxiety? Is it always with meds? Is it yoga? Is it CBT? Is there a best way to treat it?
I think it's also a great question again. I think it's a focus on where we are on the spectrum of anxiety. So I just want to also kind of revisit that there are kind of subclinical or earlier onsets of anxiety that might not meet that clinical threshold. And for that, there's a lot of preventative. We've seen in the pandemic some good evidence from research trials for kind of phone calls, self-help, and based on cognitive behavioral therapy, a type of psychological treatment that people can use on their own in those early stages, especially to help address or mitigate some of the anxiety. When we get to anxiety disorders, there are different types of anxiety disorders, obviously, and anxiety might manifest as part of many mental health conditions. But in general, we do think about psychological treatments. And again, I mentioned cognitive behavioral therapy. It's used across many anxiety disorders. And there are many others that are very evidence-based and have good response for patients. Antidepressants can be helpful for those who have more kind of serious or severe symptoms or who have not been responding to those other earlier interventions. And again, it's a misnomer. We call them antidepressants, but they actually work on anxiety as well. And so I think that's important for people to realize that they do have those kind of dual effects.
Okay. Now, Jodi, I want to flag for people that the new U of T Medicine magazine has a special edition, Age of Anxiety, which is kind of the basis for our talk today. But I was rereading that this morning to prepare, and this quote from you jumped out for me. You said, the more I've reflected on it, the more positive I feel about anxiety. And I have to say, when I read that, that made me anxious. So I want to ask you, why do you feel good about this?
I think back to my sense of knowing yourself and knowing your own reactions and using that feedback loop to inform the decisions you make. And I'm not talking just professionally, I'm talking about personally. If you're aware that you have patterns in your body and your thought patterns of responding to anxiety, and that can lead you to press a pause button, to take a step back and make choices that are well informed from your knowledge and your experience, that's going to help you. Obviously, I think about it in an emergency setting, and I've talked about the need to make our environment safe, to work in teams, to be able to sense danger way ahead of time so that you can prevent things from escalating to a point that anybody is at risk, whether it's the patient, whether it's our team members, and knowing and thinking about, why am I feeling a little off? What is it about this particular situation that's causing anxiety? And I think, André, you had some thoughtful ideas in your introduction, and you maybe provocatively asked the group, what if we didn't have anxiety? Who needs negative feelings? Why don't we just have a life where there was no anxiety? Well, I think that would be very dangerous, right? If we go back, teleologically back to the days of predators around, anxiety kept us safe. Sanjeev mentioned the fight, flight response. I added in the fight, flight, or freeze response. We're very hardwired to biologically react when there's a threat. And it's about knowing yourself and your own individual reactions to know how to override them so that you can be safe if it's a maladaptive response. Because fighting may not always be the best option. Freezing when a threat or predator is coming towards you, or something where you're going to be harmed, that's not good either. So in that environment, you may want to sort of rewire and retrain yourself to flight, to get out of the way and move out and leave the environment. So these are ways that anxiety works for us to keep us safe, to protect our teams, our families, our loved ones, and understanding ourselves better. So I've learned that anxiety is a very valuable source of information about my environment and my own risk, and have made choices accordingly.
Right. And Trish, I want to build on, we heard the word being wired, hardwired for some of this. I wonder, are people just made some more anxious than others? I have two kids. One of them has been super anxious since she's a baby, and the other one is kind of implacable. Nothing phases her. She's never anxious. Are they just born that way? Are we all hardwired a certain way?
The age-old nature nurture concept here. I know we do have, and I'm certain that both Jodi and Sanjeev can speak to this as well in terms of our understanding of genetic predisposition. But I would say in addition to that, in terms of the work that I do with adolescents, that awareness, which is what Jodi alluded to, is one of the areas that we would probably spend a fair bit of time exploring with adolescents, because oftentimes that's the piece where it may be that it's the parent driving the discourse around the symptoms that they're seeing. And the adolescent, if in the context of maybe their development, they may not have the language, the vocabulary to express that underlying anxiety, worry that they're experiencing. So to the point of the genetic aspect, I think we would probably all agree that there's some degree of genetics and some degree of the environment that plays a role. But from an adolescent perspective, what's more important is our ability to engage and discuss their concept of how they experience anxiety, and then hopefully move forward in a dialogue with them in order to move towards some effective intervention.
And Sanjeev, could you build on that a bit, this genetic predisposition versus environment? What has more impact?
So it's going to be the age-old response, all of the above, André, because I do think definitely there are genetic factors. It's why, as a clinician, we often ask about family histories of anxiety, because that can be more pervasive. We also know that, as Trisha had alluded to, that early childhood experiences or adverse early childhood experiences, which people may have read about that a lot, and we have a lot of data now on that, may predispose people to a range of mental health concerns, anxiety being one of them as well. And so we talk about kind of parental or attachment type of figures in our childhood that might provide stability, or environments that might quell or mitigate anxiety, or might worsen anxiety given some of these childhood experiences. And then I think what we've also talked about is how substance use, like alcohol, drug use, might unmask, precipitate, complicate the presentations of anxiety. And then lastly, we've talked about the physical mental health piece as well, that other physical conditions, whether you're younger or older, that if you have other medical, physical health conditions, they can kind of increase your risk or kind of worsen that anxiety cycle. So a lot to consider within that, and definitely why we see very personalized journeys of how people might present for anxiety in a variety of circumstances.
And Kymm, if we could take it from the genetics part down to the practical, do you see people, do they present differently in different age groups or different other factors that you come to expect the presentation will be different of anxiety?
Absolutely. So I think, people in the TikTok age, as I like to call the sort of, teens and early 20s, are much more likely to book an appointment. And the reason for the appointment will say mental health, and they have the jargon. Often they'll have already given themselves a diagnosis. They've got a community online. And it's not all bad, I have to say. There's a lot of insight there in some cases. Certainly, in different age groups, and it really depends on how much insight the person has, how sort of in touch they are with their emotions and also their body. So some people will come in saying, you know what, I have palpitations, I have some chest pressure. Don't drive me crazy to go get an ECG and all that, because I know it's my anxiety, right? You still are going to get them the ECG and check their thyroid and their, CBC. But either way, there are those people. And then there are the people that come in with a stomach ache and, working it up. And finally, at the diagnosis of exclusion, you'll say, do you think, the stress you're going through right now could play any role? And they're like, oh, well, gee, I've never thought about that. And sometimes making that connection. And as we know, and the longer I practice, it's so multifactorial, right? There's so much, anxiety involved in physical health issues and physical health issues involved in anxiety and the mind-body connection and everything that we now recognize. But yeah, it really does present differently for different people. And that's why the context is often so helpful.
You've reminded me several years ago, a doctor said to me, in the context of a lot of people calling in sick, they didn't want to say they had mental health issues. This doctor said a lot of the source of a lot of backaches is above the neck. And I always that always stuck with me, that people don't always like to say what's wrong with them. Trish, I wondered if you could build on something Kymm talked about this young generation. They do self-diagnose, and sometimes they do pathologize a lot of their emotions. Do you have to get into those talks sometimes, just saying, hey, it's normal to be sad or anxious?
So I think this goes back to that initial dialogue that we had around the spectrum. So thinking about worry, and then how does it tip over into anxiety that maybe then we're seeing that dysfunction or that functional impairment. And so what I often do, and a lot of the discussion that we have with amongst ourselves as providers and collaboratively with our teams, is trying to get a sense with the adolescent and then with other providers who are involved in their care as to how much of their symptoms are actually impairing their ability to function. And so it's a little bit of how do they define their symptoms? How are they experiencing the symptoms? And then in addition to that, where are those areas that they would identify as being areas that have been impacted or impaired? And I think a great example is we think about peers and or even school related concerns. We can often, at least in the school setting, engage with teachers or individuals within the school setting to get even additional information to really essentially corroborate what we're hearing from the adolescent. And it just helps to kind of put that bigger picture and provide some kind of feedback or even additional data to that adolescent to say, okay, so we're seeing this is happening. You're experiencing this in terms of what you're describing. And if there's discordance, let's have a little bit of a dialogue about that discordance. Sometimes they're doing really well, so to speak, academically, but yet they may describe that they're not doing well and that's the area that's impaired. And so it's just kind of getting a sense as to how would they actually capture that and describe that. And that's really the nature of the work that we may and we have been engaged in. And also just to that point, the importance in these settings to work collaboratively in terms of teams. So having our social workers present, being able to speak with our child and adolescent psychiatrists, our colleagues in adolescent medicine and general pediatrics, so that we're all working together to be able to kind of put this bigger picture and understand what's actually happening with a number of complex cases that we've been involved with. And of course, parents also in terms of that additional information.
Jodi, we have a lot of healthcare workers in the audience. We have a big audience today, which is great, but a lot of them are healthcare workers. There are particular issues about anxiety in healthcare. This is stressful work, and doubly so during the pandemic. You alluded to the bit earlier about dealing with people who work in ER, but are there particular issues you worry about with healthcare workers and anxiety that we should be chatting about?
Yes, it's been an incredibly challenging 18 months, as you know, for the healthcare system and everybody who's been in the hospitals and on the front lines. We've gone through so many different phases of different types of anxiety as the pandemic has unfolded. And the earlier days with so much uncertainty about PPE and about what was going on with the virus and how to keep ourselves safe and everybody else. But then just dealing with the extra barriers to connection with our teams, with our patients, in terms of being able to actually speak with people, have family members in, and going through the various waves. So the anxiety has taken different forms over the course of the past 18 months. And I think as we've had more and more information, people are feeling more comfortable. And ultimately, with the vaccine available to everybody, there's a whole other level of anxiety that's been addressed. But we're still there working in unusual situations. This is nowhere near normal. The fact that virtual care is a part of our new norm, the fact that we are still masked and that we do not get that full facial connection with our patients, and that this is something that's part of our reality. The aspect of how we dealt with this over the course of the pandemic has been taken different forms. I think the team approach with having a buddy system, with having people who share your reality in the work world, where we can get support in the work setting, has been immensely helpful. We've created whole new ways of accessing codes when there's been an event or something that's happened that's created stress on a service where people are frontline. The aspect of moral distress, that's becoming very prevalent in the literature, where people are forced to make decisions that are challenging, ethical decisions about access to critical care resources. We hear about this in the press, we see it playing out in other countries, but our own city has struggled to get people into the right settings, into critical care beds, addressing the needs and the flow medically. So we are looking at the impact of something unprecedented on us as institutions, as healthcare providers, as individuals. And I think we are coming up and identifying ways to address the anxiety in the moment with the support of our teams, with some interventions that people have been provided with, but also with access to care and treatment resources that are specifically designed to address symptoms, anxiety in healthcare workers. And that's something that our cities come together with in terms of the psychiatric group and all the people who want to help the healthcare workers who are struggling.
We have a lot of questions from the audience. I had 5 single-spaced pages worth before we even started. But there's some themes in there. And I wanted to ask you, Sanjeev, that one of the themes that comes up again and again is people want to know, can I prevent anxiety, and can I prevent a recurrence of anxiety if I've had this issue before?
Yeah, I think it's, again, I want to be clear about when we're talking about anxiety, and just going back to the fact that, again, we're all going to experience anxiety. We've just established this is part of emotion, and there's a continuum responses in terms of how anxiety might manifest. So I just want to put that out there, that we're probably not going to prevent anxiety. And as we all talked about, probably don't want to prevent anxiety because it is useful for us in various settings. I think what those questions might be alluding to is, can I prevent kind of severe anxiety and some of the more dysfunctional components of anxiety? And in particular, you mentioned for people who have maybe struggled with anxiety before, and I say that in terms of anxiety disorders or conditions, there's definitely a higher risk of that happening under high stress times for people who've experienced that before. Part of that is what we've talked about already, which is kind of recognizing our early warning signs of anxiety, what's normal, what's adaptive, and when is it starting to become problematic. And that requires some reflection, maybe some dialogue with people around us who we trust or our supports, making sure that when we think that there's some impact on our functioning, that we're reaching out early. So the earlier we get help for this, and thankful that the pandemic has highlighted the importance of mental health in this context. And so again, that might be your trusted healthcare professional that you have contact with, and kind of reaching out. And there are a number of services and resources now that have emerged during the pandemic that have been quite helpful in terms of accessing care. So I do think those are important steps along that pathway. And I'll just probably have one other point, which is I like to talk about mental health vital signs as well, and that we need to think about what are the things that we need to pay attention to that might contribute also to developing anxiety. And those are things that are part of our basic needs of nutrition, sleep, our support and connection, all things which are prone to disruption during this pandemic at different times. And so really doing that mental health check that encompasses all those components is critical. And that can help build a bit of reserve for us during these more stressful times.
Yeah, so the basic stuff matters. So let me turn to a trusted health professional, Kymm. We've seen this real shift of virtual care during the pandemic. We've heard a couple of mentions of that along the way. Has that made it easier for people to reach out, and has it changed the way you treat people who are looking for that help with anxiety?
Yeah, absolutely. So I think that, having the option to do virtual, whether it be telephone or video, whatever the person's comfortable with, or whichever is accessible to them, if anything, has been super helpful, particularly for certain age groups. So particularly for adolescents who maybe in the past would have had to miss a whole morning of school in order to, travel to the appointment, attend the appointment, and get back to school. In a teaching hospital situation where I work, on a clinic when I might have several different learners, after those clinics end, I can make a few quick calls. So I'm able to see more patients, just because my timing can be a little bit more flexible, because it's not an actual, booked visit necessarily. I can do a ton more check-ins. Also for homebound seniors, it's really been a godsend, being able to give them a call, especially at a time when, they're going to be prepared to answer the phone, and it's allowed, much more common check-ins, and really getting a sense of how much help they need and in what way. The one drawback, of course, is that you can't ensure privacy on the other end. As much as somebody may assure you that they're in a safe situation, you do need to use your gut a fair amount of the time to know when virtual isn't appropriate. So, in a situation where there may be a possibility of domestic violence, which we know has gone up, or with adolescents, if there's sensitive topics like sexuality, etc. Sometimes you do still need that in-person visit for the privacy aspect, but also for the human contact piece.
And Trish, another theme that runs throughout our many questions is people wondering how can they be a good partner or a good parent to someone who is experiencing anxiety or someone they're worried about, they think needs help. Do you have any practical tips for people how to be a good helper?
It's a great question. So I think I've kind of, or we've all alluded to this idea about dialogue and that recognition. So I think probably the most important piece is recognizing when there may be an opportunity to have a dialogue with or engage in a discussion with an adolescent who might be experiencing mental health, either distress or anxiety, so to speak. I also think that this discussion in terms of where the setting is definitively important to establish that we have privacy and that we can have a confidential discussion with an adolescent. So that's probably, I'd say, probably of utmost importance in terms of an adolescent's comfort and ability to trust that they can disclose information in a safe setting. So I'd say primarily to be able to recognize this, recognize when an adolescent may be reaching out, and then try to ensure in some ways that there's, to the best of our ability, that there is a space that's confidential. And in the case that where Kymm had mentioned, virtual care has some limitations in that way. So we may need to bring an adolescent in to our clinics. But for parents or for those who might be coaches or those who might just recognize some symptoms, teachers, for example, highlighting this and being able to bring this to not only the adolescent's attention, but hopefully engaging in some dialogue to be able to move this towards an appropriate intervention. So this would hopefully be potentially a visit with their provider, so primary care provider. It may escalate. It may be a safety concern that might require a visit to an emergency department. But we have to have the dialogue first to understand where the adolescent is and what they're experiencing.
And Jodi, I think I'll throw this several questions about, we can't have a conversation these days without COVID and lockdowns. Several questions related to lots of people are worried about the lockdown ending. They're anxious about going back into the world. Any tips for them on how to deal with that kind of generalized anxiety about the new world?
Yeah, you kind of see different reactions. Some people are the opposite. They're out there in full force, ready to party. And then others are too scared to leave their homes. And it's back to that individual responsivity. I mean, we talked about your question about kids are just born differently. The thing I think about is temperament. And people are going to have different temperaments, and that is pretty biologically driven. So people who are highly anxious people, in general, may be more anxious about re-entry. And it's taking that sort of cognitive behavioral approach of exposure, of baby steps, right? I help people get out the door because exercise is a phenomenal way to manage whatever ails you, right? Whether it's anxiety or mood problems or the fact that people are so isolated. So just getting people out walking around the block, getting them then to go a little further. So it's like building it up. Nobody's asking the highly anxious person to start sitting on a patio surrounded by tables that might feel too close to them when they've been hiding in their house for a year, right? So it's these baby steps of getting out and understanding what their own personal daily life used to look like pre-pandemic and how far away they are from that in terms of what's possible now, and then building that up. So it's not going to happen overnight. And I think as we start over the summer, things will open up more and more. People will become fully vaccinated. Some people just have one shot at this point, that kind of thing. We will start to have a system in place that allows for people to enter at their own pace and their own comfort. What I'm finding, and again, it goes back to some of the comments that Kymm was making with virtual care, is that I am seeing more people asking for live appointments right now because they're lonely. And the concept of loneliness has been so significant through this pandemic. And it's not just for people who are isolated living alone. It's where people have been cut off from their social support systems, children, adolescents, adults. We don't have that regular day-to-day living that's fuller than your immediate household. So I am seeing people ask if they can come in just because they want a different kind of human contact from what they've been getting with their families in lockdown. And it's not that they're so high risk, it's just that they need a connection. And it feels better having somewhere to go and coming in, even though they're wearing a mask, but being able to talk to a healthcare professional face to face. So I do think we're starting to move, and that there's people who really are going to reach out and need those connections and start to leave their homes. And for those who can't, then we have to work on making it feel safe to take gradual steps.
So we're almost out of time, but I want to ask you a last question, which is again one that I think probably dominated all the questions I received. People just looking for practical advice. So I think I want to ask you, you're all experts in this field. I want to ask you, how do you cope? How do you deal with anxiety? Just give people practical tips on what they can do. Maybe Trish, if you could start us off, just what's the advice we should be giving our kids?
So I just would like to mention one thing that I think is worthwhile just highlighting is we haven't really touched on the disproportionate toll that this pandemic has had on marginalized populations. And, when I reflect on my personal experience throughout the pandemic, particularly as a mother of a young male in early adolescence, I've been acutely aware of the uncertainty throughout this pandemic. And so at times it's been quite unsettling, but I also think it's been formative. And I think the main kind of learning that I've taken away from the past year, or maybe 18 months, really, is that there is an opportunity to kind of reflect and reframe, rethink in the midst of some of our moments that feel unsettling or may even be a crisis. And I think that's probably the biggest takeaway that I would say for not only for myself, but for all of the parents when I speak with them, is, let's take a moment and just reflect on where this has brought you. And let's see if we can reframe this and think about where we've got an opportunity to move forward with some next steps.
Great. It's a wonderful way to end, with a hopeful note on finding some silver lining in this. Sanjeev, do you have some practical advice? What do you do to deal with anxiety?
I mean, I try to apply it. I think we've all tried to apply it to ourselves, in addition to individuals we might be caring for in our respective roles. And I think for me, it's kind of starting with the things I can control in my life. So I talked about it before: sleep, nutrition, exercise, those moments of social connection, whether they're virtual in more restricted times, or now with reopening more gradual with those that we might trust. And so I think that's one core component. And again, I do think having some of that recognition and awareness to what Trish is talking about, kind of that reflection in that moment to acknowledge mental health. And I would say the pandemic has been a huge mobilizer to bring to the surface mental health concerns in a way that people are more apt to talk about it. I would say, I think we all know that as we continue with the pandemic, we need to continue this dialogue and not forget mental health, especially during recovery, where I think it's very instrumental. And then the other component is thinking about what things that bring me joy or gratitude in my life as well, that might be areas for us to focus on, helping someone out that might need help, doing, the social connection or joy in the activities that we might share with individuals. I think all of those that we can start to bring in can be steps towards coping during these times.
And Kymm, can you share some practical advice you give your patients?
Yeah, so 2 quick thoughts. One is that we need to change our relationship with anxiety, so we don't always have to push those feelings away. We can sit with them, notice if you get your anxiety in your chest, in your stomach, in your head. How does that feel for you? Know that it's going to end so that the next time you experience it, it's not so scary. Things that you experience more become less aversive over time. And that's really what resilience is. So I tell my patients that, I try to teach my kids that. I think that's one of the most important lessons for me. And then the other thing is the self-care piece, which we push. And I think all of us type A folks out there have now got, exercise. How many hours did I sleep? Am I eating right today? Did I call my mom? Those kind of things on our list. And I want to encourage you to also do things that don't help others or yourself, involve no learning, like watch some Netflix, make it a terrible show, no documentaries, just indulge in the things that might have made you feel guilty without feeling guilty.
Great. I'm going to go home and watch some mindless Grey's Anatomy or something.
Oh, yeah.
Jodi, final quick word. We're out of time. Practical advice.
I agree with everything everybody said, so I don't want to be redundant. I think things that have helped me through the past year plus is dealing with the monotony and the repetitive aspect and the lack of variety, and having to and thinking creatively about how to put something each week into my life that I can look forward to with so many restrictions, and whether that's a special social connection. I have had wonderful connections with friends who live all over the world, and the new incorporation of video calls and that kind of thing. So feeling closer to people that I might not have reached out to before, but being able to build on the relationship, since I'm not traveling the same way I did before, but I can travel in different ways. So realizing back to what made our life so full and rich before, but trying to figure out how we can hold on to that and add that variety and creativity and spontaneity into our lives that we can keep going with. And that's what I've been trying to work on over the past year.
Great. Unfortunately, we're out of time. I think we could go on for another couple of hours with a rich conversation, but we'll leave the audience wanting a bit. I think they all probably feel a little less anxious now, thanks to your tips and your insights. So thank you to Kymm and Trish and Sanjeev and Jodi for being here today. Thank you, of course, to the audience for tuning in to the Temerty Medicine Talk. Please remember that you can watch a recording of this and our past events on the faculty's website and YouTube channel. Everyone who registered for the panel today, even if those who didn't show up, we'll get a link so you can watch it. You can catch up and share it with your friends, especially the practical advice about watching a lot of crap TV. I think we should share that widely. And there's also finally a link to a brief survey in the chat window below. We'd appreciate you taking a couple of minutes to give us feedback so we can produce better events going forward. Temerty Medicine Talks is taking the summer off, as we all should, and we hope to see you again in the fall. So again, thank you for being there, and stay well and get your second vaccine.